So we know that histological subtypes are a risk factor for urothelial carcinoma, and we have strong evidence for, about this topic for bladder cancer. But of course we know that UTUC is a rare disease, so for this reason we have less evidence, strong evidence supporting this approach. So what we have done is to query our robust database. It's a international registry, including patients with upper tract urinary carcinoma and treated with radical nephroureterectomy. So we look at the incidence of histological subtypes, and we found 4% of patients with histological subtypes. So we can say that this is a rare disease among rare diseases like UTUC. So that's why it's very difficult to provide evidence. The most frequent urothelial subtypes is squamocellular. So we found that the presence, just the presence of histological subtypes was associated with worse recurrence-free survival, urothelial recurrence-free survival, and metastasis-free survival. And then we stratified the cohort of these patients to find the most aggressive. Of course, this analysis is limited by the small number of the patients, but we found that micropapillary is one of the most aggressive. And this is coherent to what we know about bladder cancer. Of course, this is a retrospective study. There is a bias selection, but at least now we have evidence supporting that when we have urothelial subtypes in our pathological report, we need to pay attention, and we might consider to treat this patient with adjuvant treatment, also because now we have several treatments that we can provide to our patients with new immunotherapy. So this is, I think, a strong point to support a more intense approach in patients at high risk.